Hi guys, welcome back to the channel. Last class we have started pediatric BLS. We will continuing this today also. Okay, let's start. Now coming to chest compression. For children 1.5 inches to 2 inches deep. Once the child reaches puberty, we can give 2 inches to 2.4 inches compression. Same like adult guidelines. For one rescue, ratio is 30:2. That is 30 compression and 2 rescue breaths. For 2 rescue, the ratio is 15:2. And compression rate should be 100 to 120 per minute. These are for children chest compression. That is when we are giving CPR for children. Okay, what are the steps? Safety, stimulate, shout for assistance, airway, breathing, circulation, and then reassess. Again, site safety we have deal in the last class, the flow chart. We have seen the site safety seen. Then stimulate, shout for assistance, ERS we have seen. Then airway, breathing, circulation, and reassess. These are the steps for any children's CPR or BLS. Now open the airway. We can use the head tilt chin lift procedure or jaw thrust procedure. Both can be used in children. Okay. Now checking for breathing. Check breathing in a small child. Look, listen and feel when the head is in sniffing position. Sniffing as in thoda sa upar tilted. Okay. So this look, listen and feel we follow in pediatric patient, but in adult it has been stopped. Okay. Check for pulsation, carotid, brachial or femoral for pulsation. For child we go for carotid artery, and for infants we go for brachial for pulsation checking. Okay, this is airway, breathing and pulsation. Now 15 effective chest compression at xiphoid process. What is xiphoid process? Where the lower ribs meet. 2 finger technique and 2 thumb technique, encircling hand. In infants, as in adults, we give CPR with all the fingers, like we use the palm, this joint, the heel of the hand. But in children or infant, we use 2 finger technique. That is, we give CPR or compression with 2 finger or 2 thumb technique, encircling the hand. We'll encircle our hand like this and use our both thumb and give the CPR at xiphoid process. What is xiphoid process? Where the lower ribs meet. Okay. 2 hand technique is used in child, that is the adult technique, and 1 hand technique is used in small child. We give CPR or compression with 1 hand. Okay, in infants, small child and child. In infants we use 2 finger or 2 thumb technique. In small child we use 1 hand technique. In child means that has reaches the puberty, we use 2 hand technique. That is adult guidelines only. Okay. Give 2 effective rescue breath. Okay, mouth to mouth and nose technique. We can give mouth to mouth breath or mouth to nose technique. Can be given after performing chin lift or head tilt or jaw thrust. Giving 1 breath every 3 to 5 seconds with a goal of 12 to 20 breaths per minute. हर सेकेंड पे 1 breath और 12 to 20 breaths per minute. Okay, rescue breath कैसे दे सकते हैं? माउथ टू माउथ और माउथ टू नोज टेक्निक. We can give rescue breaths. Now, bag and mask ventilation is always better and commonly used in hospital cardiac arrest. Bag and mask ventilation is always better and it's most commonly used in hospital. Okay. Once the AED is available, attach paddles immediately and simultaneously continue compression with minimum or no interruption. Okay, AED is defibrillator. We should attach the defibrillator and continue the compression. 30 compression, 2 breath for 2 minutes. That is 5 cycle. We should give. When child is intubated, give 1 breath every 6 seconds. Goal in intubated children is to maintain breathing rate of 10 breaths per minute. अगर इंट्यूबेटेड है तो 10 breaths per minute, वरना 12 to 20 breaths per minute. Okay. Now, defibrillation in pediatric ALS. First shock, if shockable rhythm is present, then we have to give shock. So first shock is given up to 2 joules per kg. Second shock is given up to 4 joules per kg, and subsequent shock should be more than 4 joules per kg, but up to 10 joules per kg. Okay, first is up to 2 joules per kg, second is up to 4 joules per kg, and subsequent shock should be more than 4 kg but less than 10 joules per kg. Okay, that's all for today, and that's we have completed the compression, the breathing, the airway for children. We have completed all. Now we'll see what are the medication we have to give for in pediatric BLS in next class. Till then, like, share, subscribe and comment. Bye.